10 Silent Brain Thieves in Your Medicine Cabinet, 2025 Update. Are you at risk? Is your medicine cabinet a ticking time bomb for your brain? In 2025, groundbreaking research reveals a shocking link between common medications and dementia. Don't let these silent brain thieves steal your memories. Our brains are the command center of our lives, orchestrating everything from cherished memories to complex thoughts. But what if the very pills we pop to feel better are secretly sabotaging our cognitive health? It's a scary thought, but one we need to confront head-on. As of 2025, the scientific community has uncovered alarming evidence connecting seemingly harmless medications to an increased risk of dementia. While these drugs may offer relief for certain conditions, their long-term impact on brain function is raising serious concerns. Are you unknowingly putting your brain at risk? This crucial guide exposes 10 widely used medications that could be contributing to memory loss, confusion, and long-term cognitive decline, particularly in our older loved ones. If you or someone you care about is taking these drugs, it's time to take control and protect your precious brain power. Let's dive in and uncover the truth. Anticholinergics work by blocking acetylcholine, a vital neurotransmitter responsible for memory and learning. This class of drugs is surprisingly common, found in medications for allergies, bladder control, and even depression. Are you taking one without realizing the potential consequences? Common culprits include familiar names like Benadryl, diphenhydramine, Dramamine, tricyclic antidepressants such as amitriptyline, and oxybutynin, used for overactive bladder. These medications might provide temporary relief, but at what cost to your long-term cognitive health? The risk is real. Long-term use of anticholinergic drugs has been strongly linked to cognitive decline and an increased risk of dementia. It's like putting a roadblock in your brain's communication network. Is it time to explore alternative options with your doctor? These sedatives are often prescribed to treat anxiety, panic attacks, and insomnia, offering a sense of calm in a chaotic world. But beneath the surface, they may be silently eroding your memory and cognitive function. Are you trading short-term relief for long-term brain health? Common examples include Xanax, alprazolam, Ativan, lorazepam, Valium, diazepam, and Klonopin, clonazepam. While they can be effective in the short term, the long-term consequences are deeply concerning. It's like borrowing happiness from the future with interest. Studies suggest that long-term use of benzodiazepines may double the risk of developing Alzheimer's disease. That's a terrifying statistic. Is it time to explore alternative, non-pharmaceutical approaches to managing anxiety and sleep? Non-benzodiazepine sleep aids, commonly known as Z-drugs, are often marketed as a safer alternative to traditional sedatives. However, they act similarly to benzodiazepines and can also contribute to memory impairment. Are you being lulled into a false sense of security? Popular Z-drugs include zolpidem, Ambien, esapicolone, Lunesta, and Zaleplon, Sonata. While they may help you drift off to sleep, their impact on your brain's ability to consolidate memories is a serious concern. Are you sacrificing quality sleep for quantity? Regular use of Z-drugs can disrupt REM sleep, the crucial stage for memory consolidation. This can lead to a cascade of cognitive problems down the line. Is it time to prioritize natural sleep hygiene practices over a quick fix? Used to manage severe mental disorders, antipsychotics can have a powerful sedating effect and suppress brain activity. While necessary for some, their impact on cognitive function, especially in older adults, is a major concern. Are the benefits outweighing the risks? Common examples include risperidone, risperidone, Zyprexa, olanzapine, Seroquel, quetiapine, and Haldol, haloperidol. These drugs can be life-saving for individuals with serious mental health conditions, but their potential side effects on the brain cannot be ignored. Especially in older adults, antipsychotic medications can accelerate cognitive decline and are often linked to increased mortality in dementia patients. It's a sobering reality that demands careful consideration and open communication with healthcare providers. Opioids are potent pain relievers, offering much-needed relief for chronic pain sufferers. However, their sedative effects can reduce alertness and impair memory, potentially leading to long-term cognitive problems. Are you trading physical pain for mental clarity? Common examples include oxycodone, OxyContin, hydrocodone, Vicodin, morphine, and fentanyl. While they can provide significant pain relief, their addictive potential and impact on brain function are serious concerns. Chronic use of opioids has been associated with structural changes in the brain and a higher risk of dementia. It's a delicate balance between managing pain and protecting your cognitive health. Are there alternative pain management strategies you can explore? First-generation antihistamines, like diphenhydramine, are widely used for allergies and colds, offering quick relief from sneezing and itching. However, they have strong anticholinergic effects, which can negatively impact memory and cognitive function. Are you unknowingly harming your brain while fighting allergies? Common examples include Benadryl, chlorpheniramine, chlortrimton, and hydroxyzine. These over-the-counter medications are readily available, but their potential long-term effects on brain health should not be underestimated. Frequent use of first-generation antihistamines in older adults may increase the likelihood of memory loss and cognitive impairment. It's time to consider newer, non-sedating antihistamines or alternative allergy management strategies. Used for acid reflux and heartburn, PPIs are among the most commonly prescribed drugs in the world. They offer relief from uncomfortable symptoms, but long-term use has been linked to potential cognitive problems. Are you unknowingly putting your brain at risk while treating heartburn? Common examples include omeprazole, Prilosec, esomeprazole, Nexium, and pantoprazole, Protonix. These medications are often taken for years, but their long-term impact on brain health is a growing concern. Long-term use of PPIs has been associated with reduced absorption of B12, a vitamin essential for brain health, and an increased risk of dementia in multiple studies. It's time to explore lifestyle changes and dietary modifications to manage acid reflux naturally. While statins are life-saving for many, there is ongoing debate about their cognitive effects. They are widely prescribed to lower cholesterol and reduce the risk of heart disease, but some users report memory fog or confusion. Are the benefits outweighing the potential risks to your brain? Common examples include atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor. These medications are crucial for preventing heart attacks and strokes, but their potential impact on cognitive function is a complex issue. Research on the cognitive effects of statins is mixed. However, if you experience memory fog or confusion while taking statins, it's crucial to discuss these side effects with your doctor. They can help you weigh the benefits and risks and explore alternative options if necessary. These drugs, often used to treat overactive bladder, can also affect the brain due to their anticholinergic properties. They offer relief from uncomfortable symptoms, but their potential impact on cognitive function should not be ignored. Are you trading bladder control for brain health? Common examples include oxybutynin, ditropan, tolterodine, Detrol, and solifenacin, Vesicare. These medications can improve quality of life for individuals with overactive bladder, but their long-term effects on cognitive function are a growing concern. Studies have found a strong link between these medications and accelerated cognitive decline in older adults. It's time to explore alternative treatments for overactive bladder, such as pelvic floor exercises and lifestyle modifications. Used to treat inflammation, autoimmune disorders, and allergies, corticosteroids can affect mood, memory, and brain function, especially with long-term or high-dose use. They offer powerful relief from inflammation, but their potential side effects on the brain are significant. Are you aware of the risks? Common examples include prednisone, dexamethasone, and hydrocortisone. These medications are often used to manage chronic inflammatory conditions, but their long-term impact on brain health should not be underestimated. Chronic use of corticosteroids can cause mood swings, depression, and memory issues. Prolonged exposure has been linked to hippocampal atrophy, the memory center of the brain. It's crucial to work with your doctor to minimize the dose and duration of corticosteroid treatment whenever possible. Remember, medications can be life-saving, and many people rely on them for chronic conditions and quality of life. But awareness is power. If you or someone you care about is on any of the medications listed above, especially for long periods, it's time to take action. Here's what you need to do. Schedule a consultation with your healthcare provider. Discuss alternative treatment options, lower dosages, or gradual tapering strategies. Don't be afraid to ask questions and advocate for your cognitive health. Embrace lifestyle changes. Explore natural ways to manage your conditions, such as diet, exercise, stress reduction techniques, and improved sleep hygiene. These changes can reduce your dependency on medications and protect your brain. Prioritize regular cognitive screening for older adults. Early detection is key to managing cognitive decline. Regular screenings can help identify potential problems and allow for timely intervention. Your brain is your most valuable asset. Don't wait until memory loss begins to take action. With the right information and proactive care, you can protect your cognitive health for years to come. Take control of your cognitive destiny today. Share this vital information with your loved ones and start the conversation about brain health. Together, we can fight back against these silent brain thieves and safeguard our memories for a brighter future.